Hello, welcome to my point. I was not able to find anybody to interview, so I went ahead and did some research and am presenting in the PowerPoint. Today I will be discussing community health, nursing, and assisted living settings. I will cover the population served, nursing roles, and how the setting impacts patient outcomes. Assisted living facilities provide support mostly for older adults who need help with activities of daily living like bathing, medication management. Residents are generally not acutely ill but are unable to live independently, so it's not so bad, I guess you could say, to where they would need to be in a hospital, but they just can't necessarily handle everything on their own. So, assisted living. Common health conditions that would put them in assisted living would be like hypertension, diabetes, a lot of times dementia, and mobility limitations. This population is also at higher risk for falls, social isolation, and cognitive decline, especially. Nursing assisted living facilities focus on maintaining stability and preventing complications. The responsibilities include medication administration and monitoring chronic conditions. They also perform routine assessments and provide wound care when needed. In addition, they coordinate care with providers and educate both residents and staff. Nurses are often responsible for identifying early changes in a resident's condition. Social determinants of health. They significantly impact this population. Many residents face barriers such as limited income, transportation difficulties, and reduced mobility. Social isolation is also a common concern in assisted living settings. Personally, I've worked at many nursing homes actually in assisted living, and social isolation is something that everyone struggles with. Even though you're surrounded with 50 other residents, it's just a different setting, and it's difficult for those patients. Nurses can help address these factors by connecting residents with community resources and encouraging participation in social activities. The social activities that we had at the nursing home were always very inclusive, and a lot of people came to them, and a lot of people enjoyed them and kind of like based their whole day around the activities, because that's kind of all they have going on. And of course, all these things support both physical and emotional well-being for the patients. Nurses play an important role in improving health outcomes. Early identification of changes in condition helps reduce hospitalization. Monitoring blood pressure and blood glucose supports better chronic disease management. Fall prevention strategies help reduce injury rates among residents, and vaccination compliance guided by the CDC also helps prevent infectious disease outbreaks. Core nursing functions in assisted living include assessment, education, ad-care coordination. Assessment involves monitoring both physical and cognitive status. Education focuses on disease management, safety, and healthy behaviors. Advocacy ensures that residents' needs and preferences are respected. That's a huge one, and I've seen a lot of needs and preferences not respected in nursing homes, and that's kind of, I always advocate, I always step in when I see that. Care coordination involves communication with families, providers, and other healthcare professionals. Connection with families is huge. Evidence-based practice is essential in reducing risks and and improving outcomes. One key example is fall prevention. Research supports interventions such as balance and strength exercises, proper use of assistive devices, and medication review. Environmental modifications like improved lighting and removing hazards also reduce fall risk. The strategies are widely supported in clinical guidelines and research. One important takeaway from my research is the emphasis on prevention in this setting. Care is focused less on acute treatment and more on maintaining function and quality of life. Small interventions such as encouraging mobility and hydration can have a significant impact. I also learned that nurses play a key role in recognizing subtle changes early, which helps prevent complications. In conclusion, assisted living nursing plays a vital role in supporting older adults. It focuses on prevention, safety, and maintaining quality of life. This setting highlights the importance of holistic patient care. And that's all. Thank you.